Quick question before we get started with the show. Do you order lab tests from companies like Dutch, DSL, Genova, or Vibrant America? Hi, I'm Dr. Carrie Jones, Head of Medical Education at Rupa Health, the absolute best place to order, manage, track, and get results from 30+ lab companies all in one place. Practitioners using Rupa Health are saving well over 15 hours of admin time each week for their lab ordering process. With just a few clicks, you can order from 30+ lab companies, that's over 3,000 tests, for free in one single portal. That means one invoice for all labs, paid online upfront. Plus, patients get practitioner pricing and receive full patient support through easier personalized collection instructions, automated follow-ups, super bills, answers to testing questions, and so much more. Go to rupahealth.com to sign up for your free account today. Now, let's start the show.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, welcome to Redefining Medicine. We're talking to the leaders of the change in medicine. And I couldn't have a better leader than Suzanne Turner today. Dr. Suzanne Turner, who's an expert in regenerative medicine, but that's just the tip of the iceberg. Dr. Turner, thank you for being here.
Erica, thank you so much.
Oh,
it's
no,
always
it's
great
my
to
pleasure.
see you.
Oh,
It's great to spend time
It's such
with
a joy. Mm-hmm. Okay. Tell us about the talk you're giving today.
Ooh, I'm excited about this. So these talks usually take a good bit of time to put together. You know that. And so this is sort of heart and soul for me. A lot of what I do in talking to patients is treat their intestinal health. Mm-hmm. So we always start with the gut. We always try to get them to fix whatever's wrong here first. There's so much of the immune system that lives right just inside the intestines. And so we know that a lot of inflammation and a lot of this fire inside that happens begins there. So if there are things that we can do to treat the intestines, we're going to fix a lot of other inflammatory processes that are happening in the brain, in the heart, everywhere else. We're going to get a lot of improvement in overall health for these patients if we start treating them with the gut. Of course, because this is in the peptide module, we do have some peptides that we'll be talking about, but there are lots of other things that we bring into the mix because peptides are great, but they need there's a lot of other things that we do first and then also in support. So it'll be a 2-hour talk today, and I'm really looking forward to being able to share that information.
And me too, watching you.
Thank you.
Going to watch you. Talk to us about, we know that in the gut, we make the hormones, we make everything, the immune systems, everything all of a sudden has become the gut. Everybody's talking about gut. We went through this phase of the leaky gut, and now we're moving into the phase of the intelligent gut. So when you're saying about peptides, talk a little bit about peptides, but also talk about things like what you're an expert in, like Butyrate, for instance. Talk to us about that.
So, Butyrate is the preferred fuel source for the microbiome, for the bugs that live in your gut. And so as we are able to either grow or allow the proliferation of the bugs that take in butyrate or that create butyrate, or if we can supplement with butyrate in the case of patients who don't have adequate microbiome, then we are allowing the body to do so many anti-inflammatory functions. We'll start to see the inflammatory signals, the cytokines that signal other cells to turn down. We see that the macrophages, those immune cells, go from that very inflammatory phenotype to the very calm janitor phenotype. We can see that happen at the brain level as well as all over the rest of the body. And so helping patients either by improving their gut bugs that make butyrate or by giving them supplemental butyrate, we can really see a big change in how their body responds as far as inflammation goes.
So who would you give butyrate to? What would be the symptomatology? What would be the testing that you do to get them to?
So this is what's been interesting over the several years that I've been practicing like this. I see that my athletes are very similar to my elderly patients.
Amazing.
And
right?
so I'm going to treat my patients with Alzheimer's very similarly to how I'm going to treat my athletes. I want them to be able to turn down inflammation, to recover their muscles more quickly, to be able to grow muscle mass or maintain at least muscle mass for some of our endurance athletes. And so in both cases, kind of both ends of the spectrum, we'll see this chronic disease patient, we'll see this athlete who's really pushing themselves to the max of what a body is capable. And so those are the kind of patients I'll primarily use it in. So for perfect examples, in the last 6 months, I've used it in my athletes for recovery. I use it in my patients with autism. I will use it in patients with dementia. We've used it in our COVID patients, such a big help for viral illness. But gosh, I hardly even see that anymore, but there's a few patients that still spring around.
Right.
I have a few entrepreneurs who own several businesses and are running companies and running households, especially women who are doing all the different jobs.
Everything.
Exactly. And so with all of those different jobs that they're doing, it's really nice to see them take a step back, take a little bit of ketone ester, or take a little bit of giving them some Akkermansia or some other bacteria that may be providing them the extra. They also can get it from, if they have a good microbiome, they can get it from taking fiber in their diet.
Food, yeah.
And so that's kind of a nice way to treat them too.
So that's interesting because, a lot of conversation revolves around fiber in the diet and about how much fiber should be in the diet. And I have patients who come in and they go, oh, I take fiber all day long, and of course I don't go to the bathroom, of course I'm bloated, of course. Talk a little bit, address that problem a little bit.
So it's interesting that I think everything in our bodies has a Goldilocks window. There's a too much, a too little, and then there's a just right. And so we're all looking for that just right. I think that applies to probiotics. I think it applies to fiber. I think it applies to butyrate. I think it applies to all the things that we do. So we just have to be aware where that window is and listen to the patients when they talk to us about how their body's responding to what we're giving them. Start them out slowly, increase their dose slowly. My favorite way, there's a hot chocolate called Coco Ringa. I love that stuff. Have you had it?
No, what is it called?
It's Coco Ringa.
Coco Ringa, I remember
delicious. It has chocolate. It tastes like chocolate, hot chocolate.
Right.
I put it in my coffee every morning, but it has, I think, 7 grams of fiber and 9 grams of protein.
Ooh, that sounds great.
Yeah, it's a really simple, and it's an easy way to get patients to do it without having to fight them.
Beautiful.
Not a lot of
they have no gut reaction.
Yeah, not a lot of intestinal distress.
Yeah, because you get a lot, I find a lot, I don't know if you find it, but a lot of people complaining with the protein supplements. I don't believe in giving them bars or anything like that, but like the powders, and they all complain about gas.
Yes.
So it's very tough to find the right one for the right patient. But I think that sounds great. I like it. Coco Ringa. I'm going to do it. Yes, we'll do Coco Ringa for sure. So we were talking about that. Talk about how you decide which patient should be doing what as far as the middle group. You're talking about the extremes, the old ones, the young ones, they have pretty much the same thing. You don't want the old ones to become sarcopenic and wind up dying, because that's really what will happen. But now what happens to the middle age group? And by that I mean 30s to 60s, 50s, 30s to 50s. What do you focus on as far as their gut?
So I think what's most important, and this is right in your wheelhouse, Erica, is where we're talking about patients, how they're metabolizing hormones,
Right.
and all the other things that we're doing with them, the peptides that we're giving them, et cetera, all the things that we're giving them, how are they metabolizing them, how are they processing? And so we certainly want to be aware of what their intestines are doing, what their, how much of their microbiome is right on, if they're processing their
hormones or whatever, their
bile acids properly, exactly, if they're processing their indoles properly, if they're getting all the nutrients that their body needs, if they're absorbing properly. So all of that happens in that age group, and then we start to see their hormones decline in function. So if we're supplementing them with hormones, we need to make sure that their gut is working properly, their liver is detoxing properly. So all of those we can watch, we can monitor with different labs that are available for monitoring how they're doing with that. But I think that's probably the most important thing, because we're beginning to intervene in those patients' lives with supplementing hormones, and we want to make sure that they're taking the things that we're giving them are being processed properly.
Right, so you do it earlier. So we find that in our practice that the sooner the better. I mean, maybe not 14-year-olds, but we're talking about 25, 30, 35-year-olds. Then you have the birth control pills problems, all kinds of issues.
Exactly.
Talk about the peptides. I mean, don't want to lose that piece. Talk about the peptides that are so helpful in the gut microbiome and everything else that we do with the gut. Talk about that for a second, because you're going to talk on stage.
This is so great because it's you have all those patients. You know, you're seeing a patient in your office and you're trying to take care of people, and you have that group of folks that gets better with your first line things, with all the things that we normally do to treat, berberine and fiber, like we talked about, and probiotics and IgG, all the things that work really great for helping people. Then you have that subset of patients who just doesn't quite, that just doesn't quite fix the problem. There's other things that are going on. Disease states like ulcerative colitis and Crohn's disease, but also just generally my intestines aren't healthy enough to support. Or if they're dealing with a particular social life stressor that may be contributing to their unwellness. And so there are several peptides we can use that augment the effectiveness of all of those. You know, one of them that's probably one of my favorites recently is using lorazepatide. Lorazepatide is one that improves the way that the tight junctions work, so that we maintain that barrier and allow your body to do what it's supposed to be doing naturally. So that's been a big help. One of the things we know that raises that worsens that barrier function is stress. And so if we can use this in the case of patients who are under a lot of stress, we know that they end up doing better than they would otherwise.
Right, sleep. Like we're totally not discussing
cognitive
sleep.
skills.
Yes, amazing. What other peptides do you use?
So that lorazepatide is one of my favorites. I really, of course, everybody is familiar with BPC 157. There's a couple
everybody, you'd be surprised.
There's a couple of
I just gave a talk yesterday. People didn't know about it.
So it's a 15 amino acid, fairly small peptide. The great thing about BPC 157 and lorazepatide actually is they're both available orally, so they can be taken and they don't get broken down in the intestines.
Which is wonderful because a lot of patients complain about getting too many shots.
Right,
so
exactly.
Lorazepatide and BPC 157 is wonderful. Oral, yes.
And depending on the patient, I'm going to choose to do that by injection or orally, but it is available orally for those needle-phobics, but it's also available if the primary symptom is intestinal. There's some unique twists in how you need to use it, and you have to come to the talk to hear me talk about that.
Absolutely, you must.
Those are two of them that we use. There are several that are important, I think.
One second, I want to interrupt you. I'm sorry. About BPC oral, do you use it in a BID dose or do you use it on a once a day dose?
I think it depends on what you're treating.
Right.
So
what would you?
Exactly. So I'm going to recommend, especially if someone is particularly unwell, if we're using capsules, that you pop the capsule open, take the capsule by mouth or put it in water and then drink it, and also take one that's an intact capsule at the same time.
Interesting.
Depending on the severity of their illness, you're going to do it once or twice a day.
And you're talking about 500 milligram capsules.
Exactly, what it's standard it comes in.
That's interesting. So when do you see the results? How quickly?
Depends on how sick they are to begin with.
Right.
But if you're doing it twice a day and you're doing that open capsule, closed capsule, usually you'll see the results 2 weeks at the outside. Almost always you'll see some benefit within a couple of days.
Beautiful. And the injectable, which is interesting, is like, talk about the injectable. Why you do BPC injectable? When do you do it?
So this is not about the gut specifically, but
Right.
we use it for all kinds of things. So I do intratendinous injections,
Right.
we do intra-articular injections, we do intramuscular injections. Anytime there's an injury anywhere,
Right.
you can do drops in the eyes, you can do in the mouth around a mouth ulcer, you can
Right.
put them. This is a multifaceted repair protein peptide that we
It's a
use. So it's
great peptide. The fact that now we realize that the hormones are made in the gut, the immune system comes out of the gut, right? And the next step is the brain, right? And the brain-gut connection, and when we say it, it actually bothers me because it's not a brain-gut connection. They're one and the same, really. But the importance of keeping the gut in a non-inflammatory, peaceful state, and how it reflects on the brain.
Yes.
Say something about that.
So that's what I was mentioning before about
Right.
the bile acids and how important they are and how they get
You're
differently modified based on what your microbiome is doing.
Right.
And so the concerns that we have is if you don't have the proper microbiome, if there's some dysbiosis going on, we're going to see that those bile acids be modified in a way that are more inflammatory or toxic to brain cells. So that begins to trigger a response that tells the brain to create inflammation. So then we get things like fatigue. We get things like, in more significant things like MS, ALS, dementia, those sort of things that occur. But more commonly what we'll see in our practices is we'll see patients with cognitive dysfunction, we'll see fatigue. Those are brain fog, fatigue, cognitive dysfunction, some anxiety, some depression. And I talk to my patients about how depression is not a Prozac deficiency.
No.
It is
Exactly.
an inflammatory state. And so we need to figure out where the inflammation is coming from. And often we can start with working on what's happening in the gut. If we can fix this and slow this down, even things like people will think that they have just I'm just allergic to dairy, wheat, nuts, they make their long list. And I said, I don't think that this is an allergy problem. I think this is a primary gut barrier problem, a primary intestinal bug problem. Can we start there? And maybe we can get rid of some of your brain fog and fatigue.
Right. I think this is really important because you're talking about true prevention.
Right.
And I think that when you start dealing in that area, you will prevent disease. And you'll not just prolong health life, the length, the longevity, health span, the quality of life. It's wonderful. Thank you so much for joining us.
Pleasure,
I'm honored
Erica.
to have you here.
So good to see you.
So great to see you.